Okay, so in this video, we're now totally upright. We've moved from lying down to sitting to standing. Now we're just doing stuff up against the wall right here. So I've got Richard leaning with his back up against the wall. He's got a couple steps just a little bit out from the wall. And what he's doing here is we're just going to focus on alignment of his hips. So I'm going to have you do is a little rotation back and forth with your hips. And actually, let me have you stand a little bit further out from the wall there. There you go. Alright, so we're going to take away that arch in your spine and bring you back just a tiny little bit. And we're just going to focus on rotating the pelvis in an anterior and a posterior pelvic tilt right here. So we're just rotating forward and backwards. You're going to feel an engagement in your abs. You're going to feel an engagement in your back. And you're going to get a little bit of the hip flexors and the glutes as you go back and forth. So we're just rotating through here, moving the spine, getting things to engage, to stretch and lengthen and shorten, back and forth. And we can do about 10 rotations completely going back and forth here. Okay?
Definitely feel this tendency to want to put my hands up against the wall for like stability.
You can do that if you want to, that's fine. Yeah, we're not trying to do a balancing act right now. We're just trying to get some basic movement through the lumbar spine and the hips. So keep going, we'll do a few more rotations here. Okay, and now what I'm going to have you do is bring your hips all the way back up against the wall. So you've got your back up against the wall, you're completely pushed up against the wall. You've got your head, your rib cage, and your hips all up against the wall there. Really nice and aligned, very upright. And then in this position, we're taking that belly button and we're pulling it back towards the spine as much as we can. We're really sucking in with the belly button. Don't forget to breathe, and we're holding this for about another 30 seconds right here. Okay. There we go. We're just having that nice upright spine. All the spine is in alignment based on the wall. Make sure you have those 3 points of contact, the head, the rib cage, and the hips. They're all touching the wall right there. Okay. Awesome. Just a few more seconds here. Doing good. Keep breathing. And go ahead and relax. Now what I'm going to have you do is step even further out away from the wall. We've got a pretty far stance out from the wall right here. Make sure that you're not overarching with your abdomen. Make sure that your spine is back in a pretty neutral position. When in doubt, bring yourself back even a little bit further. What you're doing is keeping your weight into your heels right here, and we're just holding in this position. It's basically a reverse plank that we're doing up against the wall, and you're just feeling those lower back muscles engage. Okay, so you should feel a little bit in your glutes, your hamstrings, and a little bit in your low back. You just want to make sure that you have a nice alignment from your head and your chest all the way down into your legs. You really want to watch that overextension of the low back. Make sure that you're keeping the hips back a little bit. Also be careful about what surface you're doing this on. We're doing this on carpet, but be careful that you're not slipping when you're doing this on socks or on a slippery surface or anything on the floor. If you're on a wood floor or on a rug or anything like that, make sure that you're not slipping out when you're doing this, okay? So be really cautious about what you're standing on. We're just taking those nice breaths. I'm going to hold this one a little bit longer, a little bit over a minute here. Just engaging that low back. How do you feel when you're doing this one, Richard?
Calm.
Yeah. Pretty easy, pretty relaxing, right?
Yeah.
There's a pretty low level of engagement here. Not too intense when we get up to our standing. Using the wall to support us. I'm just relaxing, taking deep breaths. Okay. Now, when you want to come out of this, start by putting one foot back. You can use your arms up against the wall to keep you stabilized, and then you'll slide yourself higher up as you take your feet back into those steps and get upright again. And that's all we're doing for this video.